Right, good afternoon, and thank you for joining us for this media briefing regarding the ongoing outbreak of COVID-19 in the Territory. Just a quick note before we get started, I kindly ask all participants to mute their microphone until called upon to limit any potential feedback. Providing remarks this afternoon will be Premier Carolyn Cochrane, Minister of Health and Social Services Julie Green, Chief Public Health Officer Dr. Kandola, Executive Director of Clinical Integration Scott Robertson, and Assistant Deputy Minister of Education, Culture and Employment Shannon Barnett-Aikman. As usual, following the remarks of our speakers, we will open the floor to questions. I'll run through each outlet one at a time, and everyone will have the opportunity to ask at least one question and one follow-up to our panel. And the order for questions has been posted in the chat already, so you can see it there. I'll repeat it after, once we get to the question and answer period, I'll repeat that order. And please, if you don't have a working microphone, please type your questions into the chat and I will read them for you. I will now turn it over to Premier Cochrane to deliver her remarks.
Thank you, Ali. Good afternoon, everyone, and thank you for joining us today. The COVID-19 pandemic has been unpredictable, as we've all seen. Our situation can change in an instant. Yesterday, we announced new measures to protect the health and safety of residents in 2 South Slave communities. Gathering restrictions in Hay River and the containment order issued for Ndilŭ First Nation are necessary steps to prevent further spread of the virus and any additional strain on our healthcare system. These type of restrictions have worked in other communities, and we're confident that they will be successful. To residents of both communities, please follow the orders, stay home, and stop the spread. We're also monitoring the situation in Ndilŭ closely, and ask residents of the community to continue to be diligent and follow the public health recommendations. We know this is a difficult and at times scary situation for communities that haven't experienced a significant number of cases or community spread, but we're committed to supporting you through this. We will continue to work with local leadership at all levels to provide regular updates and guidance as the situation evolves. As we implement these new and necessary measures in the South Slave, we're easing restrictions in Yellowknife, Dettah, Ndilŭ, and Behchokŭ, and moving forward with the new proof of vaccination initiative for non-essential business across the Territory. Dr. Kandola will provide more details about what this means for communities in a few moments. We've said that we'll use every tool at our disposal to ensure that we're able to protect residents and communities, but also to ensure that we can move forward and to support a return to normalcy. We're also announcing today that all students will be permitted to return to in-person learning this coming Monday in Yellowknife, Dettah, Ndilŭ, and Behchokŭ. This is due to the downward trend in case numbers in those communities, a positive sign that the measures we put in place are working. This decline, however, is largely because residents have followed the orders and are doing their part. COVID-19 is going to be a part of our lives moving forward, and we need to strike a balance that allows residents to live their lives and for our business community to begin to recover and thrive. Small businesses make up over 90% of the businesses in the Territory. They provide jobs for residents and help make our communities vibrant. As we celebrate Small Business Week in the N.W.T, I want to thank the business owners who've invested in the North and for making our communities a better place to live. I know this continues to be a difficult time for many residents, but I remain hopeful that we're going to come out of this outbreak soon. We have a number of new initiatives underway, including the new school screening program that supports students going back to school on Monday. We'll be rolling out a rapid testing program for businesses in the near future. And with that news, and the news that the Pfizer has asked Health Canada to approve the vaccines for children aged 5 to 11, there is reason to be optimistic. We just need to continue to do our part and make good decisions that'll support our collective efforts to curb the spread of the virus. We can do this. I know it. On that, I want to turn it over to Minister Green. Thank you again, and stay safe, everyone.
Thank you, Premier Cochrane, and good afternoon, everyone. Throughout the pandemic, we've seen hundreds of cases of COVID-19 infect N.W.T residents of all ages. in both large and small communities. We've seen dozens of hospitalizations, and tragically, we've lost 9 N.W.T residents to this disease. While we're seeing cases decrease in Yellowknife and Behchokǫ, case counts are rising in other communities. The new public health orders announced yesterday for Hay River and N.W.T First Nation are not easy for residents. We have learned from previous outbreaks that we can significantly reduce the spread if we all do our part and stay home as much as possible. In addition to the public health orders, the N.W.T has recently announced 2 new initiatives, as the Premier referenced, that are designed to allow N.W.T residents to return to a new normal. The the COVID-19 in-home school screening program will help us identify cases of COVID-19 and contain the spread of the virus in larger schools in a way that minimizes disruption to families and students. The N.W.T proof of vaccination credential has been available for 10 days, and over 10,000 individuals have downloaded the document. This week, residents can access the proof of vaccine credential in person at their community health center, or if in Yellowknife, at the new service center in the Center Square Mall. The new credential is an important and in many ways necessary document in order to board an aircraft, participate in community events, or access retail services. Vaccination remains the #1 defense against COVID-19. I'd like to acknowledge that the N.W.T healthcare system, while strained at times, has continued to effectively manage the demands of the pandemic. Healthcare workers across the territory have stepped up time and again to meet these demands and deliver services to N.W.T residents. We are grateful to them and to the support of staff from the Canadian Red Cross. To the residents of Hay River, N.W.T First Nation, and Nunavut, we're with you. Many N.W.T residents across the territory have experienced the challenges and fears that come with a local outbreak. Now is the time to step up and do your part for your community. Remember, stay home, stay safe. Thank you. I'll now turn things over to the N.W.T's Chief Public Health Officer, Dr. Kandola.
Good afternoon. With a lot of hard work by everyone, N.W.T is making progress in our fight against COVID-19 in our communities. The situation in Yellowknife, Dettah, Ndilŭ, and Behchokŭ continues to improve. The number of people with active COVID-19 in these communities continues to decrease. There are still COVID exposures happening, so it is important to continue with some protective public health measures for everyone to continue to build their own protection into their lives. N.W.T's progress comes from people deciding to put on a mask every time they enter a building. It comes from businesses and customers making sure people are not standing too close together while waiting for their coffee or shopping. And it comes from knowing that if you feel even a little unwell, you have support to work from home or stay home and arrange testing for COVID. The public health orders are not the only thing keeping us safe. You are, and thank you. Everyone in the N.W.T should continue to build daily protections into their lives. Protecting yourself means you're also protecting children in Yellowknife, Dettah, Ndilŭ, and Behchokŭ, who are returning to school on Monday, and those in communities that continue to go to school. All N.W.T schools have safe return to school plans. Those plans put into practice risk mitigation measures and safety protocols to create the safest school environments possible. In addition to these safe return to school plans, we are adding the at-home COVID screening pilot program. All of these measures ensure the best possible protection for our school-age children. It is one more safety net in our collection of safety nets that will increase monitoring and give parents greater peace of mind for ages that are unable to have additional protection from the vaccine yet. children under 12 who are not yet eligible to receive vaccines, but youths and adults can protect children by getting vaccinated themselves. So ultimately, people who are eligible for vaccines get vaccinated, and we can help to protect children who are not eligible. We can do our best to keep children in schools and reduce COVID transmission in our communities. Has N.W.T removed the specific containment and gathering orders in response to the Yellowknife, Dettah, Ndilǫ, and Behchokǫ outbreak? N.W.T will move forward with our new territory-wide gathering order on Friday. The new order will ease gathering restrictions for some communities and tighten them up for others. However, there is one large safety net included in this order that can be implemented. Part of this order is a streamlined process for application to vary from the public health order requirements, meaning businesses and organizations, if approved, can have larger gatherings by implementing a way to ensure all people that are eligible for vaccines at these gatherings are vaccinated. So once this order goes into effect on Friday, any business, organization, or individual that would like to vary from the current public health order on gatherings will need to apply for a request to vary from the public health order. This application must be completed by businesses, organizations hosting gatherings and events that wish to expand the current indoor limit of 25 people or outdoor limit of 50 people or host a high-risk activity. And those are the gathering limitations that would be in effect for the entire territory as of Friday at 5 p.m. with the exclusion of Hay River and Ndilǫ for addition. So this includes businesses, organizations, and groups who would like to use proof of vaccination credentials to expand their capacity and reduce distancing. The new form is now available on the N.W.T COVID-19 website, so businesses can apply now and prepare for when the order goes into effect. It's really important to note that all previously approved applications to vary under the old order will sunset, and a new request will need to be completed. You can use your old request as a draft when filling out the new form so that you're not starting from scratch. Fortunately, this new order does not apply to communities under temporary gathering or containment orders. As we lift those orders in Yellowknife, Ndilŭ, Dettah, and Behchokŭ, we are introducing them in other communities that are not under additional restrictions. The best thing about progress, though, is that once we learn how to meet and rise above those challenges, we have the tools to address these challenges and work together to support them. So there has been a sharp increase in the Kandola First Nation on the Hay River Reserve. We have put a containment order in place there to quickly limit the spread before it impacts multiple households and to try to avoid severe outcomes. Both Hay River and the Kandola are so connected, so we are also seeing signs initially of early community transmission in Hay River, and in the last 4 days we've seen about 10 cases arise in the Kandola First Nation. So Hay River is also under a temporary gathering restriction, and this is the same approach that we have used for the very communities that you'll see the orders lifted on Friday, and it does work. We had to work hard to make it work quickly. These orders may not be needed to be extended for these communities because we have learned from the experience from N.W.T, Yellowknife, and Behchokŭ that if you put in the orders quickly early on, once you start seeing community spread and number of exposures, that you hopefully can contain it a lot quicker, and we hope to avoid further extensions. For both communities, it is recommended that only essential travel take place between the communities, and so non-essential travel is not recommended for Hay River, nor is it recommended for Kandola, both coming in and going out. And in addition, if families have to travel from the Kandola First Nation, we are recommending to limit to one fully vaccinated individual. We understand that you have to go into Hay River to get essential supplies, groceries, and gas. But if you can limit as much as possible traveling between the both communities, it'll be a lot easier to control spread. And then for everyone, please also remember that some travel is necessary, some travel is essential. So it is time for everyone to support each other in these two communities, and a time to be kind to each other. Finally, local public health and my office, we do continue to monitor the situation in Nunavik. and we are hopeful that this situation remains under control. So Nunavut stay the course, keep working hard, keep encouraging people who are still fearful or reluctant to get vaccinated, including those eligible for boosters or third doses. We are learning that immunity from COVID-19 starts to decline after 5 to 6 months. Boosters will help prevent infections as immunities start to wane. And thank you, everyone across the territory, for your cooperation and willingness to follow all the public health orders and support each other through this. We need to see the same resilience and community mindedness in another region now. And so I thank everyone for all the hard work they've done to date, and please continue to support communities that now starting to enter the same scenario that we have seen in Sawtooth, Yellowknife, and Behchokǫ. Please reach out and please be kind. Thank you.
Thank you, Dr. Kandola. I just want to let everyone know that our regular moderator, Ali Kincaid, is having technical issues. So I will be stepping in to handle the moderating duties moving forward. For those who don't know me, my name is Andrew Livingstone. I'm the Senior Media Relations Advisor to the Premier. So I will be handling the moderating duties moving forward. So we'll turn to the question and answer period of the media availability. Just a reminder to media to please direct your question to the appropriate speaker, and we will give one question and one follow-up. To start, we have Walter Strong with CBC. Walter?
Hi, Natalie Pressman here. I'll be taking the CBC question. We're hearing lots of buzz about COVID cases in Ndilŭ. I'm wondering, are you able to indicate whether or not that's true?
Dr. Kandola?
So every day with a 9 a.m. cutoff, we collect information of where cases are occurring by community, and we publish that usually later on in the evening. So expect an update today around COVID cases and COVID cases per community and region, and that will likely be online early this evening.
Thank you, Dr. Kandola. Natalie, do you have a follow-up?
Yes, thanks for that, Dr. Kandola. I'm also wondering if we could get a little bit of clarity on the process of being tested when traveling from Yellowknife to other communities. Is that still a requirement? And maybe you could just let us know if that testing happens when you arrive in the other communities and how quickly results come in from that.
I can give you a high level and then defer to Scott Robertson for the specifics, but it's a recommendation if there's non-essential travel coming in and out of Yellowknife, that if you are going to the community, going back to your community, that you arrange for testing as early as possible and repeat testing on day 8. There are some communities where there aren't any health centers in place, and so those communities, they arrange for testing in Yellowknife before they leave. And I can have Scott Robertson expand on this. This is more operational. Thank you.
Thank you. Yes, for anyone who requires testing for travel to a small community, they can do that in Yellowknife at the testing center by booking an appointment online or going during our walk-in hours. People can also receive testing on arrival in their home community at the community health center or public health unit, again, by making an appointment for those. Those are services that are not available after hours or on an emergency basis, so please book in advance. In our smallest communities, such as Sigachik, Wrigley, Deamery River, etc., we don't have a regular nurse always on location. Testing may need to be done in another community. All of those return tests can be done by our ID Now point of care device. It takes about 15 minutes to process the test and about an hour for us in total to get the result back to the individual.
Great, thank you. Next in line, we have Claude St. Denis from Radio Canada.
Yes, I'd just like to know, we spoke yesterday and the past 2 days actually about becoming of more people from the Red Cross and the new help provided by the federal government. I just wanted to know, well, when was this this help asked for, and where it's going to be dispatched in the system?
Minister Green, do you want to answer that question?
Yeah, sure. Thanks for the question. It's my understanding that the request was made last Friday, and the Canadian Red Cross has allocated an additional 10 staff with a focus on infection prevention and control. That has to do with training and train the trainer type situations. So this is a new role in addition to the work they've been doing nursing and also with the day shelter in Yellowknife. Their exact deployment is going to be the subject of conversations today and tomorrow. Thank you.
Claude, do you have a follow-up question?
Yes, regarding the reopening of schools and at-home testing, I just wanted to know, is the documentation ready in both languages at this time?
Shannon, do you want to take that question?
Sure, thank you. Honestly, the translation is through for this morning. Whether or not it has been distributed to schools, it will be going out by end of day today. So we can expect that that will be out to all schools and all families within the next 12 hours. Thank you.
Thank you.
Thank you for that. Next up, we have Luke Carroll from CKLB. Luke, are you on the line, and do you have a question?
Yes, I do. Thank you. I just was looking if we could get an update on the shelter situation in Nunavut. Is there a temporary shelter set up, or are the ones that had the outbreak, have they reopened? Yeah, just looking for an update there. Thank you.
Minister Green?
Yeah, the shelter in Nunavut is operated by the N.W.T Housing Corporation. So my request would be to follow up with them. Thank you.
Premier, did you want to answer that? I apologize.
Yes, thank you, Andrew. Yes, the Nunavut homeless shelter has been set up again. There are when the shelter did shut down because of the need for staff and residents to get tested for COVID, the COVID Secretariat stepped in and provides shelter for all of the residents. Now that the residents have been tested, some of them will be staying in the shelter, the isolation shelter, those that are mandated. But being that the shelter is reinstated again, those that are testing negative at this point will be allowed to go back to the shelter. Thank you.
Thank you, Premier. Luke, do you have a follow-up question?
Yes, thank you for that. So just for the exemptions for businesses, were they, just looking for some clarification there, were they just able to apply for those exemptions today, or have they been able to like earlier in the week or last week? Thanks.
So the online exemptions to vary has been functional today, so the businesses can apply today. And we also are putting the draft order up today as well. The order will go into effect Friday at 5 p.m. We established a new online process to be able to allow businesses to apply a lot quicker, but that involved a new technology, and that new technology came live this morning. So you can go on right now and apply if you're a business organization or event organizer.
Thank you, Dr. Kandola. Next, we have Emily Blake with Cabin Radio. Emily, do you have a question?
Hi, yes. My question is, now that we're seeing increased cases in both Hay River and in Nunavut, I'm curious if the territory is aware how these outbreaks have happened or how cases are spreading.
Dr. Kandola?
In some scenarios, we don't know how the case is being introduced. We do see clusters of infection. So once a case is introduced, the household tends to also become infected, or in the underhoused population, other shelter users tend to be infected. But in some scenarios, we may not know where the original source came from. It could be from importation. It could be from travel in and out of Yellowknife. We don't always know. And what we do know with Hay River and KFN, there are some cases that the original source is not documented, but they are having clusters of infection from that original case. This is always a source of concern, and this is why we are putting in place a containment and gathering order, because of this community spread, and also because from the community spread we've seen a number of exposures that is a cause for concern. In addition, we've had 4 out of 5 schools impacted in the Hay River and the Ndilǫ First Nation. With respect to Inuvik, it's a different situation. It's the same scenario. We had cases that we don't have a firm contact. We don't know where that or established source, but we do know that those cases that we have picked up, that spread has occurred within their close contacts, and because of the very quick work and rapid response of Inuvik Public Health, they've been able to contain those cases in their contacts to date.
Thank you, Dr. Kandola. Emily, do you have a follow-up question?
Yeah, I've heard some cases of people that are still having challenges downloading their proof of vaccination. What supports will be available for them?
Scott, would you take this one on?
Currently we have 2 methods. Currently in Yellowknife, people can present in person to the Center for Remote Location to receive assistance with having a proof of vaccine credential downloaded. And there's also an email address. People can email if they're having issues to receive support that way. More options for people who are outside the Northwest Territory. The streamlined process for that is in development and is expected to be announced in the next week or so.
Thanks for that response. Next, we have Thomas Ethier from Media N.W.T. Thomas, are you on the line?
Yes, hi. Can you hear me well?
Yes, we can.
Perfect. So, a question about the test kits, about that pilot project in the schools. We were wondering if those test kits could be given elsewhere, could be extended to maybe workplaces or at-risk workplaces such as day and sobering centers.
Shannon, do you want to take that question to start, and then maybe we'll pass it over to Dr. Kandola or Scott to add to that?
I actually will defer to Dr. Kandola on this one, given the kits are seeking to be sought outside the school jurisdiction. Thank you.
So we're talking about 2 different programs. They both were developed at the same time by different leads. So the COVID-19 at-home student screening pilot program was a bridge that we were developing for those children under 12 to allow for surveillance of children who are not symptomatic, but to allow surveillance of at least 10% of the student population to pick up cases early. We know with this particular population, they tend to have very mild symptoms, or they tend to be asymptomatic. And by having a screening program, we're hoping to catch cases early before they start spreading to other kids in the class. So this is specifically a school screening program, and this will bridge time, hopefully, to when we can have vaccines available for the age 5 to 11 school student age. The other program you're talking about around shelters is a different program, and I believe there's some work underway, but that's not the OCFO lead. That will be over for Scott Robertson.
Thank you. Yes, we have started piloting a community-based screening program using the same type of test as the school program for businesses and organizations where there is high contact between staff and the public. We are currently piloting this program in Yellowknife, and we'll be making an announcement in the next day or so around wider public availability of this program for all communities in the Northwest Territories. And the materials and the information are translated into French already, so all the training materials and information for the public, it will be available both in English and French. And it's a self-directed program. There are online videos and training packages. This has been launched in other jurisdictions in the country. And right now we're just piloting that with several companies and organizations such as shelters in Yellowknife, and we'll be expanding to Nunavut shortly. And to make sure that we have that the training materials are effective and working out any of the little kinks, but that will be available by announcement very shortly. Thank you.
Thank you. Thomas, do you have a follow-up?
No, thank you very much.
Great, thanks, Thomas. Next, we have Simon Whitehouse from NNSL. Simon, are you on the line?
Yes, good afternoon. I have a question just about the mandates. I've spoken to a few people recently who have a lot of concerns about the mandates right now, and that they're really not given a choice at all, because people have to choose between their livelihoods and getting a vaccine that they legitimately don't want to put in their bodies. Often these are based on personal reasons, whether it's because of past negative experience with vaccines, or because they feel that they're just not getting sound information to make them feel that Moderna is either effective or safe. What do you tell those people who feel like they aren't being given a choice and feel they are now being forced to be immunized?
Dr. Kandola, do you want to take that question?
That the mandatory vaccine policy is not under OCFO. So.
Sorry, Simon, can you clarify if that question was specific to the proof of vaccination credentials, or are you talking about the GNWT's mandatory vaccination policy?
Well, the N.W.T and the school board ones as well. So I suppose the N.W.T mandate, yes.
Premier, do you want to take that question?
Yes, thank you. We started with implementing. Our priority has to be to keep residents safe. You know that we've lost a few people, and it's been horrible for family and friends of community members. So our priority is about the safety of residents. Within that, we started with doing a mandatory vaccination for those who dealt with vulnerable populations, but we didn't realize how big that became. And the communities were asking us, please protect their communities as well. A lot of people traveling from Yellowknife into the smaller communities, and there's legitimate fear, like you said, about vaccinations, but also fear of people coming in from outside carrying COVID. So they asked us to implement it more widespread. We've done that, but we've also, if people can't get vaccinated because of medical, there are options. So if you have a valid medical reason, then there's testing options that can be done. But it is a choice people have to make. And the other thing is there's going to be hard choices coming up too, because we're also working with the federal government. Anyone who wants to travel on any airlines will soon have to be double vaccinated as well. I know it's tough for people, but it's not only about yourselves. It's not only about choices. It's the choices of those who have no choice that you have to think about. So again, I can't stress enough the need to get vaccinated. It's about all of us and protecting those who are most vulnerable. Thank you.
Thank you, Premier. Simon, do you have a follow-up question?
Yeah, I have a follow-up question just in regards to businesses. I mean, it's Small Business Week this week, I believe. Some businesses that I've spoken with said they feel there's 18 months into the pandemic, they're really taking the brunt of the pandemic, and the government's just out of touch with what they're going through. Because at the end of the day, non-essential businesses seem to be bars and restaurants, as well as, I suppose, gyms, small retail, and churches. What do you say to them, especially if they're questioning, whether it's even worth to continue operating a business in the Northwest Territories?
Premier, do you want to take that question?
Yeah, thank you. I'm going to say I know it's been tough. It's been tough for all of us, and it's been especially tough for businesses up in the Northwest Territories, the smaller ones that are struggling to keep their doors open. I know that there's been federal relief programs that have come. I know we're trying as the N.W.T. We have relief programs for businesses. We have wage support programs. We are trying the best we can. the reality is the options that the CPHO is implementing will meet that balance, is what we're projecting. That if you choose not to do the mandatory vaccination, to be checking people, that's fine. Stay within the limitations, so hopefully you can stay open. But if you do that, then you can increase your capacity. And I think we all want to get back to normal, whatever normal looks like. But we also want to make sure that people are safe. Thank you.
Thank you, Premier. Next, we have Kevin Dow from True North FM. Kevin, I believe you have a question in the chat, which I will read out for Dr. Kandola. Is there any worry about the outbreak in Hay River reaching the levels it did in both Yellowknife and Behchokǫ? Is there anything that was learned from these two outbreaks that can be used to help mitigate the one in Hay River?
Well, we've learned a lot. We learned from Yellowknife, Behchokǫ, and Satu. And one of the things that we learn is when you start to see community transmission, when you start to see the involvement of high-risk populations, such as the unvaccinated children, and when you have early indications that there could be spread or multiple exposures, you need to act very quickly to contain at that moment and provide the appropriate type of restrictions. So with the N.W.T First Nation, it was a containment order, and with Hay River, it was a gathering order similar to Yellowknife. It's for 14 days. What we learned with Yellowknife and Behchokǫ, that a strong support, a strong local response also can provide the support for people to isolate safely. So what I do urge Hay River and N.W.T First Nation is to reach out to those people, isolate and help them isolate safely, reach out to their family members who may be isolating with them, and see in what ways you can support them if they need groceries, if they need special prescriptions filled. Like, reach out and isolate and work together as a community. And if that occurs and the cases are happening earlier and we have less transmission, then the faster the community can actually exit the gathering orders and the containment order, hopefully without an extension. So we did see the signs. What we have seen in Hay River is in the last 8 days, there's been a tripling of the number of active cases, and there've been a number of cases without no established source. There's also been established cases that have multiple exposures, and we have seen cases in 4 out of the 5 schools. So that has signs in the last week that this is starting to increase. In fact, it was the 2 communities that showed the higher number of active cases yesterday. They were the ones that increased, where other ones had remained relatively the same or have gone down. So I do have confidence in the two orders that were announced yesterday, and just to urge people to isolate responsibly, and hopefully together as a team we can get out of this in 14 days. Thank you.
Thank you, Dr. Kandola. It looks like we're back to the top of our media list. I think we have some time to go through one more time for a question and a follow-up. Natalie Pressman from CBC, do you have a question for the group?
I do, thank you. Given how closely connected Enterprise is to Hay River and Kandola First Nation, how will the containment order and gathering restrictions impact residents of Enterprise?
Thanks, Natalie. Dr. Kandola?
So at this point, we haven't had any indication of any introduction or any cases in that particular community, because non-essential businesses are reduced to less than 10, and gathering outdoors is reduced to 25, and there's no household visitation. There will be an impact for Enterprise in terms of what they can and what they can't do, particularly because they're so close to Hay River. But we do caution them to avoid non-essential travel in and out of Hay River, do their groceries, do the shopping, avoid visiting. because visitation is restricted to household members only, and if they themselves become sick, to isolate and arrange for testing. But at this point, there's been no indication that there's been any cases in enterprise.
Thank you, Dr. Kandola. Natalie, do you have a follow-up question?
I do. Thanks for that, Dr. Kandola. I'm wondering also, the Premier mentioned at the beginning that there's a rapid testing program coming to businesses. I'm wondering if you're able to tell us anything further on that.
I'll answer that question. So yes, we have a community-based rapid screening program that we will be launching. We have started it this week in Yellowknife as a pilot with some organizations. We'll be releasing more information about that in the next couple of days. We're just finalizing all of our pilot testing with those groups. The program will be called Detect N.W.T, and it's designed as a screening tool for people who have no symptoms to help to pick up any cases. And we're targeting businesses and organizations where they have high frequency contact with the public. We're currently piloting this at some shelters in Yellowknife, as well as a long-term care facility. And we'll be expanding that across the Northwest Territories. This will be a program that is designed to be completely run by an organization. You do your own training online, use your own staff to do it. People can be trained to take their own samples. You can do it right in the workplace. And it will be offered at no cost to organizations.
Thank you, Scott. Claude Saint-Denis from Radio Canada, do you have a question for the group?
Yes, I do. Regarding that program we're just talking about, if we take the business side of things, it really looks like, high contact with public businesses are the same kind of businesses that those who can actually apply for the exemption. Is there any plan or any idea to kind of use this program to supersede or complement the vaccine proof of vaccination verification for those businesses who are not necessarily comfortable with the idea of asking their clients to show their proof?
No, this program is not designed for you to get out of having to be vaccinated. This is a program that's helped us design to detect COVID in asymptomatic individuals. It's not designed for a workaround for people who choose not to be immunized. That's not the purpose of this program. We really need to focus our efforts on making sure that we are detecting COVID early, particularly in communities where there is known community transmission, and that will be the focus of this program.
Thank you. Claude, do you have a follow-up question?
Just a matter of calendar. Is there any date for the enlarging of the thing?
We intend to announce more information about this program in the next couple of days, and then we will expand it across the N.W.T. We expect there'll be a lot of interest in the program, and it'll take us a couple of weeks from the time that an organization submits their application online until we can get the tests out to the locations, and we'll ask people to be patient because we do expect there'll be a lot of interest, and we only have a couple of people who are running the program, so just bear with us as we get to you.
Thank you.
Great, thank you. Luke Carroll from CKLB, do you have a question?
Yeah, so with the proof of vaccine credentials for businesses, I'm just curious why is it up to 25 people are allowed to attend a business that does not have these requirements? I'm just wondering why that number was settled on. Why not 10 or 15? Just curious. Thank you.
So this was based out of the phase 2. We were in phase 2 with 25 indoors, 50 outdoors, has a baseline from June 2020 to June 2021. And within that, the under 25, people still have to be able to isolate safely. So if there's only room for 5 people, cramming 25 people in there. That's not would be considered wise. We were saying it's a limitation that of less than 25 indoors and over 50 outdoors to not require an application to vary. And if people feel like they can have a higher capacity than that, or if there's certain high risk activities, then we're asking all businesses, organizers, institutions, and event organizers to apply online. But the default of 25 to 50 was a number that worked really well for us for an entire year and kept our COVID cases down, but allowed some flexibility of some businesses don't need to have more than 25 and they could safely operate but not need to do an application to vary.
Thank you, Dr. Kandola. Luke, do you have a follow-up question?
Yeah, just on a different subject, like as the cases are trending down, at least here, Yellowknife, Behchokŭ, Dettah, Ndilŭ, I'm just thinking, looking back on this outbreak, is there anything the N.W.T wishes they had done differently, or that they really learned from this whole experience when it first started in the SAW2? Just, yeah, a bit of reflection.
Dr. Kandola, do you want to chime in first, and then maybe Premier or Minister might want to add some comment to that as well?
So back in May and June, when we had came out with the Emerging Wisely plan, everyone was excited. We had increased our vaccination coverage. We were trending upwards. We had just recovered from the NJ outbreak. For N.W.T and the rest of Canada, we're very optimistic because the numbers kept on going up, cases kept on coming down. What we did not factor in was a Delta variant that pretty much drove the Alpha, Beta, and Gamma variant to the ground and is now 100% of our COVID variant right now. And it almost like we went into a new type of pandemic. And N.W.T is experiencing the first wave of this new pandemic. This variant is highly infectious, and one dose of the vaccine doesn't cover has been fully immunized. So when you put these factors together, and the fact that we had relaxed travel restrictions and we saw a significant increase in travel in August, and we had about over 12,000 people coming back in that month, and this new highly infectious Delta variant that is where we have to be fully immunized to have better protection against it. Combining those factors together with relaxing of outdoor restrictions, relaxing of travel restrictions, led to spread. And once we had that spread, given the nature of this particular Delta variant, it was very difficult to undo that spread. Specifically, it went for the under-vaccinated regions, under-vaccinated pockets. And what we noticed with close and prolonged exposure is even people fully immunized had breakthrough cases. So what we need to do is realize that we're not out of the pandemic, that a variety of public health measures work. They're mandatory masking, gathering restrictions, the proof of vaccination, border controls, having vaccines available for kids 5 to 11 relatively soon. All these things are going to work and get us closer to try to build a normal life as possible. But the only time we'll get out of pandemic is when globally we get out of the pandemic. So this is where we are today. Thanks for the question.
Thanks, Dr. Kandola. Premier, do you want to add to that at all?
Thank you. Yes. I think when you talk about lessons learned, we are hopeful that before the end of this government, we're hoping at the end of the pandemic, we'd do a lessons learned document, but now it looks like this might be an endemic versus a pandemic. But the biggest thing I learned is the need to work together. I have to say that the N.W.T staff and communities, governments and the Indigenous governments have been phenomenal about being flexible, about being able to navigate and move according to the needs. So what we've been trying to do is whenever a community gets hit, we try to look for the commonalities, things that we can improve that for the next community that might be able to do better. But we also recognize we need to be flexible because every community is different and their needs are different. So again, the best thing we've done is not being being humble enough to recognize we can't do it alone, and working with our partners around the table is the most vital thing that I would share with anyone. Thank you.
Thanks, Premier. Minister, do you want to add anything?
No, thank you.
All right, thanks, Minister. Next in line, we have Emily Blake from Kevin Radio. Do you have a question?
Yeah, in Yellowknife, the outbreak was initially declared among the underhoused population, and now an outbreak is being declared among shelter users in Nunavik. I'm curious what the territory has learned or what it has taken away from the initial shelter outbreak in Yellowknife.
Andrew, I guess I'll take that one. I think the most important thing is when you look at the shelters, what the common denominator is: homelessness, underhoused. So the need for housing in the N.W.T, that's been a long-standing priority of the Northwest Territories, and it's even come to the forefront within this assembly, and definitely since COVID hit. So the biggest thing that we're carrying forward, it's become, although we have, I believe, 22 priorities, housing is, you'll hear it in every session, and it's a strong focus that we've taken with the federal government and trying to address the need for housing. Thank you.
Emily, do you have a follow-up?
No, thank you.
Thanks, Emily. Thomas from Media 10-1, do you have a question?
No, I'm good. Thank you very much.
Yeah, no problem, Thomas. Simon Whitehouse from NMSL, do you have a question?
Yes, I just had a follow-up question from my business-related question, and you may have touched on this, but is the government looking at any additional financial assistance for businesses that might be struggling right now? Is that something that's ongoing right now?
Thank you. Yes, like I said earlier, there's a limited number of supports right now that we've implemented. I believe it's $5,000 for ITI. I believe up to an extra couple of thousand for BDIC. We can get you those figures after. We've also implemented a wage subsidy program, maximum of $10,000 per employee, to be able to support employees that want to keep people employed. And the other thing that we're doing is the federal government did help a lot, and then we went into an election. So I've had an initial meeting with the Prime Minister, and at the meetings that I'll continue with, we will be seeking further support for the COVID relief, for the health, for the N.W.T, for municipal governments, Indigenous governments, and the business community. Like I said earlier, we're all in this together. So as I go forward and seek further support from the federal government, I will carry that message as well. We're all in this together, and I'm lobbying for all of us. Thank you.
Thank you, Premier. Simon, do you have a follow-up question?
No, that's all I had for now. Thanks.
You're welcome, Simon. Last, we have True North FM, but I'm hearing in the group chat that they are good with their questions. It is now 2:57, so we're 3 minutes ahead of schedule, which is great. This will conclude the end of the briefing. I just want to thank Premier Cochrane, Minister Green, Dr. Kandola, Scott Robertson, and Shannon Barnett-Aikman for attending today, and thank you to the media for being here. You'll see in the group chat there's some additional information and resources, links to links to more information on some of the topics that are being discussed today. So if you can go there to get more information. If you have any follow-up questions, please reach out to us through the press secretary account, and we will do our best to get back to you as soon as possible. I want to thank everybody again for being here today, and have a wonderful Wednesday.